lockdown, restrictions, sealed borders, halt in public transport services such as railways, buses, taxis, and also closure of public places including restaurants, parks, schools, museums, shopping malls, offices, and other industries unravels that the COVID-19 considered as the biggest challenge in the public transport. A total of 1.4 million cases in India were reported according to the study. The government of India has introduced Jantar curfew last April 22, 2020. And as you can see on the screen, figure 2.8 shows the percent change in the mobility trends for India has an interesting observation that the car, denoted as drive and walk trips, start decreasing from mid-March. However, the main goal of the study is that the land transportation industry should take paradigm shift in urban mobility, as this will serve an opportunity to transform and implement new policies, have sustainable transport systems to bring forth a safer and disaster-resilient public transport. Through the discussion of the data gathered, analysis of data, the contributing factors of the problem, and recommendation that will be explained by me, Santa Ana, Ate, Hilaga, Logente, and Baldonado. In India, public transportation or PT is an essential mode of transport of the people. The transit-oriented development or TOD in urban areas are a great way to refute the negative transport externalities. The TOD concept minimally integrates efficient transit systems such as rapid transit systems on road and on rail, and most especially the personal rapid transit or the PRT. The underlying problem here is that the broader the PRT implementation, the more risk of failure it may cause, for the reason of the rise of the new technologies, followed by the repulsive guideways and the lack of operating experiences. Another critical aspect is the relatively high initial cost, a fraction of PRT, and can be overlooked as the lower operating cost than other forms of PT. Moreover, resident purchases private vehicles, adding up to an already severe congestion crisis.
Baker in 2015 says that the commercial air travel is one of the reasons due to the rapid spreading of SARS. That is why when SARS-CoV-19 was identified, border lines to different countries and states were closed, as well as all modes of transportation such as flights, railways, and public transports were limited and some are closed. And with that, the transportation sector of the tourism industry was hugely affected. On this study, there are several problems that the transportation sector faced during the outburst of COVID-19, which are: first, people doesn't have freedom to choose the mode of transportation they will going to take. Second, the ad-event scheme was made obligatory. Third, decrease on trips. Fourth, changes in travel policy. And 5, reduction in ridership are observed and the absence of public transportation. First, people doesn't have the freedom to choose the transportation they will going to take, as travel mode depends on monthly income, marginal congestion, travel time, travel cost, purpose of the trip, convenience, and emission pricing. Second, private vehicles and some public transport are obligated to follow this ad-event scheme, a procedure where there are vehicles that cannot go out when their plate number ends with odd or even numbers to avoid traffics. Third, decrease on trips of train and other public transportation because people implanted in their minds that they could easily catch a virus when they ride a public transport with various people who came from different places who do not know one of them have the virus. And this problem caused the public transport operators the crisis in financial management, crew management, fleet management, and operational and service delivery. Fourth, changes in policies are observed as well as travel restrictions. Due to the virus, unnecessary activities and gatherings are prohibited. Working hours have changed. Health campaigns and policies about bicycle lanes are made that also makes non-motorized transportation took advantage. Fifth, and last, is the reduction in ridership, which is also implemented that results in a much more worries of people who travel daily for work. Due to the absence of public transportation, people do not have any other choice other than using bicycle or owning or buying a car that can cost them financially. These happen because policies are made to avoid close contacts to other people and to lessen the rapid spread of the virus.
The researcher's method of gathering data is through a web-based survey using Google Forms. The survey questionnaire was divided into 5 sections. First section are set of questions related to travel when there is no pandemic. Second section is questions about travel during the pandemic. Third section are questions focused on travel related to post-pandemic. And fourth section is to identify the choices for the planning of new public transport system. And last section is for the social demographics and attributes of the respondents. There were total of 470 respondents, excluding those students from the institutes to avoid biased responses and focus only on the commuters and urban travelers. The responses were categorized into tier. Tier A for 5 megacities and Tier B for 42 million plus cities and 50 plus cities. Researchers also categorize the purpose of travel as primary and secondary. Primary refers to trips such as work and education, while secondary refers to trips such as social gathering, shopping, leisure, and etc.
In moderate travels, public transport services are being replaced with intermediate public transport modes. In such a strange circumstance, travelers chose safety over affordability. The main reasons for the change in travel modes are the risk of infection, the travel mode's unavailability, and the expectations that the service will be bad when it resumes. In the current situation, which has been brought on by the outbreak of COVID-19, it is safe to say that public transportation is the first casualty among urban mobility alternatives. Given the need for physical distance in outdoor areas, not only will public transport ridership suffer, but it is also clear that existing public transport infrastructures will fall short of meeting demand while maintaining any amount of physical distance. Travelers are inclined to avoid public transport in post-COVID-19 situations due to the fear of contracting an infection in closed social places. The point of the study is to propose a public transportation discounting system for the midterm in order to entice private motorized vehicle travelers and to transfer existing users from peak to off-peak hours. Evidently, as the discount increases, so does the percentage of people who use public transportation, which is mostly made up of motorcycle riders. Because of the capacity limits of transit vehicles, which are not included in the current simulation model, the rise in the public transport share will become large in the real-world implementation when compared to the simulated situation.
The study scrutinized the COVID-19 outbreak impacts on travel choices and succeeding mobility shift of individuals with respect to their primary and secondary activity-based trips before, during, and after the lockdown period in the Indian context. It was shown that there is an increase in the car dependency pan-India level post the COVID-19 crisis. It was seen that the public transport and non-motorized transport mode users are willing to alter into private motorized vehicles, but this will depend upon the recovery period of transportation systems and investments and promotion of active travel modes. It was also revealed that people are willing to pay extra for a travel that is safe, fast, clean, comfortable, and resilient transport. It was shown that there will be a push of bicycle share from 31% to approximately 44% if there's bicycle superhighway. Overall gain in the system welfare will be achieved if travel demand moderation will be implemented. Lastly, there is a positive impact when public transport fare will be reduced due to mobility shift from private motorized vehicle. There should be a resilience planning for public transportation systems to combat the future shocks of pandemic and other emergencies. To conclude, it is very evident that the pandemic have a massive impact on travel behavior and the choices of the individual to satisfy their travel needs. It was illustrated in the study that there might be few major issues every city might face in the near or far future due to the COVID-19 disruption and other emergencies. Effects of the short-term and long-term policies were presented. And lastly, there should be reduced trip lengths substantially or need of private motorized transport for various secondary activities by the self-sustainable neighborhoods.